I'm Scott Loughlin. This is the Data Chronicles, and here are your data points. On today's episode, we are discussing the new state privacy laws and how they uniquely apply to sensitive information, including health data. As listeners know, three things are happening right now. U.S. states are passing comprehensive data protection laws, many of which include specific obligations for sensitive data, which also have expansive definitions, and most of which include all healthcare-related data. Second, states are passing health-specific laws that uniquely apply to health data. And third, states are adopting geofencing rules and post-Dobbs related laws that apply specifically to information collected about who may be visiting doctors or facilities of any type, including those who are providing reproductive medical services. Today, we'll focus on the first two of those themes and save geofencing for a separate episode. The new health privacy laws that we are seeing present a number of challenges and opportunities for health, life science, and other companies. But one thing is important to note at the outset. Health privacy is not new in the United States. So while many may see these laws as changing the landscape in the same way that general comprehensive laws did, that's a misinformed view because health privacy has always been a pretty crowded landscape in the US, both at the federal and at the state level. These new laws just make things more complicated, especially with respect to how the new laws will interact with the old laws. So lots to discuss. To help, I've invited two of my team members to join, Donald DePass, a counsel in our DC office, and Paige Papandrea, an associate in our New York office. Both Donald and Paige focus their practices on health privacy and work with clients to manage the interaction between the global, federal, state, and local laws, all relating to sensitive data. Paige, Donald, welcome to the podcast. So Paige, perhaps I can start with you. Can you just give the audience a high-level overview of what we are seeing in these new health-specific laws at the state level?
Sure. So a few years ago, when the Dobbs decision came down, we saw some states take pretty quick action to protect health information that falls outside the traditional healthcare sector. These states are Connecticut, Nevada, and Washington, with Washington leading the charge. These state laws are generally different than the comprehensive privacy laws we've seen in California and the like. They apply much more broadly. Then they don't have thresholds that regulated entities need to meet. If you handle consumer health data, you will be regulated under these laws. Consumer health data is also very broadly defined and includes types of data that aren't traditionally thought of as healthcare information. These forms of stealth health data may include location information that reveals you went to a certain pharmacy or went to pick up a prescription, or they may include things like medication purchases or internet searches that reveal a particular health condition.
So Paige, that's really interesting. And I want to pause there for a second because the existing health privacy laws that we've had sometimes uniquely apply to specific types of entities. I mean, that's a theme that we have seen for a long time in the health privacy space. Some laws will apply to healthcare providers, some will apply to healthcare payers, some will apply to organizations who come from technology backgrounds and so forth. And what I heard you to say is that what is unique about these laws is that they actually apply to a wider audience than just traditional healthcare organizations.
That's correct, Scott. These laws were designed to kind of bridge the gap between laws like HIPAA and state HIPAA-like laws that apply to more traditional healthcare providers and the more broad, large companies we see regulated under the state privacy laws in California, Colorado, and Virginia. So if you handle consumer health data at any volume, you will be subject to these laws.
So, Donald, Paige raises a really good question and issue. You have spent almost your entire career kind of working on health privacy related issues, including issues around how clients can use sensitive information and manage the associated risks. And one of the really important issues that comes really at the beginning is trying to identify which laws are going to apply with respect to the uses of that sensitive information. And I think we've seen laws both at the federal and the state and local level. How do you see these new emerging laws fitting into that existing complicated landscape?
Yeah, I think these laws make that challenge even more complicated. As Paige mentioned, the intent of many of the laws is to fill in gaps or perceived gaps covered by the pre-existing laws that generally apply to a smaller subset of the health ecosystem, what we tend to think of as more traditional healthcare entities like healthcare providers and health plans and healthcare clearinghouses that are subject to HIPAA, or sort of targeted state-sensitive condition laws that apply to specific types of health data that we consider more sensitive and deserving of more protection, like genetic information or mental health data or reproductive health information. And now we have these broader consumer health privacy laws that apply beyond those sort of traditional healthcare applications, and that apply beyond those more traditional healthcare entities to tech companies, for example, that have healthcare offerings, whether it be something like a smartwatch or a fitness tracker, to even other organizations that may sort of incidentally collect data that could be considered health within the broad definitions of these laws. And so there's a lot more work that needs to be done up front to confirm, A, what data are you collecting and processing, and B, which laws apply to those activities before you can even begin to figure out what your compliance obligations are.
So let's just kind of rewind to that HIPAA point quickly, because I think folks who work in the space will know this, but I think many of our audiences probably would expect that HIPAA would apply to healthcare data. HIPAA's been around for almost 25 years. And I think it's one of the most well-known privacy laws in the United States. And I think what I heard you say a moment ago is, despite popular perception, it doesn't apply as broadly as maybe people would come to think. And importantly, that means that the states are looking to fill the gaps that HIPAA created or were created when HIPAA was initially enacted.
That's right, Scott. And I think it's important to put in context that the types of consumer data that are being generated today probably weren't on the minds of regulators and legislatures when the original HIPAA law and its implementing regulations were put together. So HIPAA applies fairly narrowly when we think of the full ecosystem of health data in the US. It applies to most healthcare providers, it applies to health plans, and it applies to entities known as healthcare clearinghouses. But there is a vast amount of consumer health data that's collected and processed by everyday technologies, whether it's your smartphone or, again, fitness tracker, smartwatch, remote monitoring tools that fall outside of the scope of HIPAA, and that regulators and legislatures, as you mentioned, are really looking to start protecting in ways that HIPAA maybe wasn't designed to.
Paige, interested in your thoughts on kind of areas where you see big themes across these laws. I mean, I've heard a couple in your comments and in Donald's comments around the expansive notions of what would constitute health information, or the expanded set of entities that would be regulated under these laws. Do you see those as themes, or are there additional things that you would also highlight?
Sure. So in addition to the broad applicability of these laws create more unique notice and consent obligations, generally across all three states. Then when you look at states like California and Colorado, Washington in particular imposes very specific notice obligations. The Washington AG has advised via guidance posted on its website that it wants a separate and standalone link to a privacy policy that contains content only prescribed by the law. In effect, what this requires is a specific Washington notice to address the requirements of the Washington My Health, My Data Act. There's also much more limited purposes for which you can use or share consumer health data versus other state privacy laws. Generally, it's limited to what's needed to provide a consumer requested product or service, or maybe some specific security related purposes that are written into the law. Otherwise, you're going to need consent that's similar to the consent you see under the Colorado Privacy Act regulations, It's going to have to disclose certain things and be given before the consumer health data is collected or shared. Even more so than just the baseline consent that's required for use or sharing of the consumer health data, these laws impose a HIPAA-like authorization requirement for the sale of consumer health data. It's a very lengthy list of requirements that need to be provided in the authorization. The authorization needs to be maintained for several years. What we're seeing is a trend towards increasing protections on how consumer health data can be shared outside of an organization and really putting guardrails on permissible uses for it and limiting how that data can be sold, shared outside with third parties, such as with data brokers who may then amass a certain laundry list of consumer health data.
And I think one of the other general themes that we have seen, which is really important for the audience here who has historically had to manage health privacy issues, is that there are exemptions in place under these laws that would take out organizations who are covered by HIPAA, for example, from having to comply with these obligations under these new laws. Is that right?
Correct. So the HIPAA-related exemptions under each of the laws varies. For example, Washington exempts only PHI, meaning that certain businesses that have business lines involving data other than PHI may have that data subject to Washington's law. Nevada contains a HIPAA entity level exemption and a PHI exemption. Although we read the Nevada exemption on its face to be fairly broad, the meaning and intent and legislative history behind the law reveals that that entity level exemption may be a bit narrower and apply to specific business lines rather than an entire company. Connecticut, due in part to the fact that the Connecticut's Data Protection Act was amended to include these consumer health data requirements, includes a very broad HIPAA entity level exemption and a PHI exemption, meaning that more traditional healthcare companies may not have obligations under Connecticut's law.
So, Donald, interested in your perspective on how organizations may develop their strategies and implement their strategies to comply. And maybe we start with some of the issues that Paige was raising, because Paige is saying, if I got this correct, right, there is a lot of new consent obligations, a lot of new notice obligations, a number of areas where, frankly, HIPAA may be more permissive than what is now required under these state laws. HIPAA at the same time, right, acts as a floor, not a ceiling on what states can do. So states can actually regulate, and some of them do, and have historically done so, where they impose more strict obligations. So some of these legislators could apply the Washington My Health, My Data restrictions, even HIPAA covered data, and that wouldn't necessarily create an issue under HIPAA. Interested in your perspective on how organizations start to pull all of these threads together and come up with a comprehensive strategy to comply.
Yeah, so I think, the first step is understanding what data you have in your possession, what the sources are. Does it fit within the definitions of health data under this new wave of laws? If so, I think you need to take a careful look at the entity and data level exemptions that Paige referenced. If it's an exemption that's written very broadly and you're a HIPAA regulated entity, maybe you are mostly or fully out from the requirements of the law. If it's a little bit more narrow, you need to perform an assessment of which aspects of your business operations do fall under the scope of these laws. And one challenge in particular, organizations that may be facing compliance obligations under multiple frameworks, whether it be HIPAA and the state law or whether it be multiple state laws, is to figure out sort of the lowest common denominator, which is a common approach that we see our clients take when they are subject to multiple frameworks. They figure out, okay, well, where's, the most stringent requirements, and can we just set a baseline of complying with those requirements across the board? That may be feasible in certain circumstances and with respect to many of the requirements that apply under these laws, but something that we've been seeing clients challenged with is that certain aspects of these laws are written in ways that treat residents of specific states uniquely, such that there may need to be bespoke solutions in certain circumstances or for certain contexts which organizations would use to build on top of whatever their baseline is that they try to establish across the board.
Paige, interested then, in a way that Donald was describing this, I think a client response that we'll get from one of our clients, they'll say, well, I comply with HIPAA, so there's nothing else that I need to do here. What's your reaction to a statement like that?
Well, I'd advise the client to maybe discuss with their in-house legal team, the difference between HIPAA and these laws. These laws impose different obligations than what we're seeing under HIPAA, largely in part to a good point that Donald raised earlier. These laws were designed to cover information that may not have been at the top of regulators' minds in the late 1990s or early 2000s. They are intended to be much broader. They're intended to capture the types of data that are collected by everyday consumer technologies that are largely becoming unavoidable in everyday life. The differences in these obligations, I think, are important, particularly when you look at how these laws are enforced. You have Washington's law, which has a private right of action. So there is a different regulatory risk with choosing to take a one-size-fits-all approach to whether it be notice or consent for health information that a business may collect. You want to make sure that your business meets the requirements of these different laws. And while we can, assist our clients in finding certain synergies between the laws, there will be distinct obligations under each.
Let's talk a little bit about what that enforcement looks like, Donald. So Paige mentioned a private right of action in Washington. Presumably there's also enforcement by other law enforcement or regulators. What does the enforcement landscape look like under these new emerging laws?
Yeah, so there is a private right of action in a narrow subset of these new laws, but more commonly, there is enforcement authority for state attorneys general and other regulators that closely mirrors what we see in sort of the standard consumer protection frameworks under state laws. And so attorneys general typically are empowered to enjoin certain activities as well as to pursue civil penalties in the event of violations under these laws.
And Paige, is this, so I think you had mentioned what we have three that we're focused on as being those very specific health laws, Connecticut, Nevada, and Washington. What does the landscape look like in the future? What's on the horizon here? Is this the only three that we would expect, or is there more to come?
That's a great question, Scott. We are finally starting to see movement in this area again. We saw Washington, Connecticut, and Nevada come out in rather rapid succession after the Dobbs decision was handed down. There was a lull in legislative activity in this area, although other states did attempt to pass bills similar to these. Now in 2024, we are starting to see these laws come back rather quickly. We have 3 states who have introduced bills very similar to Washington's My Health, My Data Act. Those states are Hawaii, New York, and Vermont. In particular, Hawaii and Vermont are near copycats of Washington's bill, which is the broadest and imposes the most obligations on businesses. So those are 2 states to keep an eye on. I wouldn't be surprised if we saw a few more states move in this area, as we are seeing a lot of legislative focus around sensitive health data this year.
Well, I really appreciate both of your insights. Maybe I would just conclude with asking both of you a question. As being practitioners in this space, I think one of the things that's happening is that privacy professionals are really overwhelmed with the number of developments in this particular space. They're not in the position where they have the staffing to always continue to scale at the levels that are needed to respond to these new developments. From each of your perspectives, any kind of practice points about how to start to engage with these new laws to really understand what, if any, impact they will have? Donald, you go first.
Sure. I go back to something we talked about earlier, which is to try to figure out a baseline using a common denominator. I think while there are distinct requirements in specific states, there is enough commonality in these laws that if you establish sort of a global baseline, you will get 75, 80% of the way. And so, I would take a hard look at what are my strategic markets and how do those align with where these new laws are being passed and where regulators are particularly active, and maybe choose one or a few states to start my program with. And from there, I can figure out how best to scale in a way that's manageable given the resources available.
Yeah, I think important points. Paige, any other things you would add?
I second what Donald has to say. I think finding whether it be, a law firm, another industry source that you can follow that tracks legislative developments, it's very helpful to see the trends and where different states are going with these laws so you can get an idea of what may apply to you in the future. We're starting to see regulators put out more guidance on these laws. Connecticut's Attorney General just released a report on the CTDPA. Although it doesn't really address consumer health data head on, reviewing reports or guidance from AGs can give you or your team an insight into how these laws may be applied. And I think that that's very helpful for laws that are written as broadly as these.
Yeah, I think great point too. Well, Donald, Paige, thanks so much for joining the Data Chronicles. Really appreciated today's conversation and looking forward to having you back in the future. With that, I'm Scott Loughlin. This is the Data Chronicles, and those were your data points.